Hello, and welcome to the Cycle Endometriosis podcast, where we will delve deep into experiences, challenges, and triumphs of those navigating a life with endometriosis. Join us as we share the stories of resilience, offer insights from experts, and foster a community of support for those affected by this often misunderstood condition. Whether you're newly diagnosed, a seasoned warrior, or seeking understanding, I hope this podcast is here to help empower you and uplift you on your journey. Tune in as we break the silence, shatter stigmas, and amplify the voices of the endometriosis community. Medical disclaimer: this podcast is not intended for the purpose of providing medical advice. All information, content, and material of this podcast is for informational purposes only and is not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. Thank you so much for being here, and now on to the show. Hello, everyone, and welcome to this month's episode of the Cycle Podcast. Let's welcome our very special guest today, Billie Jo. Welcome to the Cycle. How are you today?
I'm good, Melissa. How are you?
I'm doing well. Thank you so much. I appreciate that. So before the show, I was telling Billie Jo I was at the gym and I went to the infrared sauna, which we both agreed we enjoy. So if you are watching the video of this, I'm sorry I'm a little bit more athletic and a little red in the cheeks because I just went to the sauna about an hour ago. But that's enough about me. Billie Jo, why don't you tell us a little bit about yourself?
I think first I just wanted to say thank you. I'm grateful that you're having me on your platform. I really appreciate it. Billie Jo. I turned 45 this year. I live on the East Coast, Canada. I was born in Canada, lived in Ontario for the majority of my life. I currently spend the majority of my time rehabilitating myself and working on my healing. I was a former first responder, so I have a bit of a medical background, which plays into my story a little bit with my experience with endometriosis. And I enjoy working out. It's one of my biggest pleasures these days because I'm actually able to. And I really love nature. So anytime I can be out in the sun and with the trees and the forest, it's my happy place. And I have a lot of plants now, and they're my babies, and they're surviving for the first time because I think I'm thriving for the first time.
I love that. I love
Yeah.
that. I love
Yeah.
being in nature too. I really do
Yeah.
find that to be so healing. Well,
Yeah.
we're so happy to have you here today, and thank you for the kind words, and we're grateful for you coming on and sharing your story. So why don't we just start from, I know you have an outline and you're very organized, but
Yeah.
just start from the beginning of like when you realized something might have been off.
Yeah, absolutely. So I was a bit of a late bloomer in many ways. I was behind in my development from a puberty standpoint, I felt, from most of my peers. So I got my first period when I was 14, late into 14. And that was in 1992. I remember that very, very vividly. It was at the time, it was a very kind of traumatic experience for me because I wasn't prepared for it. And suddenly I was just experiencing extreme cramps that seemed to come out of nowhere. I was by myself at the library and had I was just like, what is happening? And I just remember going to the bathroom and going, oh my God. And realizing there was a lot of blood. And I was like, I don't know if this is normal. And I remember what felt like a very shameful bus ride home. And I remember getting home and getting into the bathtub, and just even my very first experience, my very first period was very painful. I had back cramps and severe menstrual cramps. I was nauseous, and there was a really heavy bleeding. So right out of the gate, my very first experience. And I remember talking to because I have a lot of older sisters that had gotten their periods before me, and talking to my mom, and it was like, oh, it's just totally normal. Some people experience pain, not really a big deal. But also on the side, my mom would give me, it was a bit of what do you call that, where her mom did it for her, and so she did it for me. It was kind of like the treatment like a treatment they had passed down, and it was actually hot chocolate and whiskey. So
Wow.
yeah,
Wow.
but I actually, so later on in my life, I actually did a little bit more research and a bit more of an understanding of that. But it was the alcohol was like used as a bit of a, a pain reliever, and the heat from the hot chocolate in your tummy would help with the cramps.
That is the first time I've heard that.
Yeah,
People on the show have probably heard me say before, but my grandma, she's the one who basically raised me, would give
yeah,
me hot milk and butter. Oh,
yeah.
gosh.
But I mean,
But
when you,
it was the
yeah,
same thing. She had
yeah,
really painful periods. And
yeah.
so she was like, this is what I did.
Yeah,
She
so
was
it's
from
almost like
Wisconsin.
it's an internal heating pad.
Yeah, I
Um,
guess.
yeah,
And the hot
um,
water bottle. That was something
yeah,
that was told to me too. Okay.
yeah,
So you
right out of the
start and
gate.
you remember all of this. Yeah.
Yeah, and it it didn't get any easier. The periods were really very irregular. Sometimes they would last, like I would bleed for 30 days straight. Sometimes I have two periods a month. A lot of nausea, migraines, like headaches, bad headaches, usually 3 days in a row. And I would get really bad diarrhea just like either the first day of my period, or the day before, somewhere in there. Um, and yeah, and I would just remember like just being almost bedridden for 2 days, like legs up on the wall, crying in pain, missing school, yeah, right out of the gate. So
Yeah.
yeah, yeah. And then it was probably about, I'm gonna just go to my timeline.
See, it's so helpful to have it. It
Yeah,
is because there's so many layers of like all the things
yeah.
that go on.
And I definitely know I had interactions with my family GP in that time frame. And
Hmm.
again, it was just like, oh, it's just normal. There's nothing wrong. Some
Yeah.
women experience that, pain like that. And so
Yeah.
I just basically accepted that, and it was like, okay, this is how it is, apparently.
Right.
Um,
Right. And it's not like anyone was outwardly talking about it either. So it's
no,
you very much probably like me. I just assumed everyone was going through this behind closed
yeah,
doors. I really
yeah.
did.
It was, I mean, fairly similar to another medical issue that I have. I just like, I thought everybody felt that way about this, but
Right.
yeah, not the case.
Yeah.
I think it was about, so age 20, so around 1998, I again went to see a GP, and I was also in a new relationship. And so I was looking at birth control and discussing all the other symptoms I was having, and they suggested Depo-Provera, something I certainly regret in hindsight. So yeah, at age 20, I started the injections of Depo, and I was on that for about 5 years. And although it, I think, helped with some of the, like, because I wasn't getting a period every month,
Right.
right? So I wasn't
Right.
experiencing the cramping. The side effects that I had from the Depo were equally as challenging for me.
Yeah.
Again, migraines were a consistent thing that didn't help with that. The weight gain, the breast tenderness, like I couldn't even hug people sometimes. Like my breasts were just so sore all the
Yeah.
time. And it just was terrible on my mood. Um, and so yeah, but I was on it for 5 years because, granted, I was like, I don't have to deal with my period. So
Yeah.
it was like kind of like a catch 22, which one's
Right. It's
worse?
like, right. Do I
Yeah.
want this? Do I want that?
Yeah.
I know. I
Yeah.
know. It's so hard.
Yeah. And then I guess from there, I, I left that relationship, in a new one, the one that I'm still in currently to this day. And so I decided to stop taking it so I was 25 years old, and I came off the Depo, and coming off of it was just, it
Really hard.
it was a nightmare for me. It was like having all of the symptoms on steroids. Like everything was just turned up. And it took about probably a year, if not longer, to regain some semblance of a normal cycle. Um,
Wow.
but yeah, but in that time, this whole time, right from day one, from my first period, and then getting those periods back, all the same things: migraines, nausea, cramping, headaches, constipation, diarrhea, and a whole bunch of other symptoms that, again, in hindsight, I wouldn't have known were related to endo specifically.
Right. At that point, were
Yeah,
you just thinking like this is just how it is,
yeah,
and this is just something that I deal with, and it's
yeah,
normal, and that's just how it is? Because again, very much for me too, it was like I never correlated the constipation, the migraines, diarrhea, all that with even around being around my cycle. I never thought that it was all related. I
yeah,
really just thought everything was like a separate thing. Oh, I have a stomach issue. Oh, I have that. I thought I had an ulcer. Like that's really what
yeah,
I thought.
yeah. I mean, I think at that point, definitely from around age 25 to age 35, I was I was seeing a lot of different medical specialists for a constellation of symptoms that did not seem that they were related in any way, shape, or form. And I mean, we can talk about dismissive medical uh, experiences and gaslighting, because those were definitely part of my experience as well. But those also played into all of that for me, and trying to seek other specialists to try and be like, okay, well, I know something's going on, and I know this is not normal. Like, not everybody feels this way. So,
Right. Right.
yeah,
For those like 10 years, you were seeing a bunch of you were fighting. You were
yeah,
fighting to
oh
find the
yeah.
answers because your intuition knew something was off.
Yeah, and and again, with my, and at that point, I was already in the medical field, right? So I think that was a bit of an extra challenge for me. It's like, but I know this information. Like, I know how to do the research. I understand the physiology of the body. I understand when things aren't going right, what that looks like.
Right.
And it was almost like I was, in a way, like too educated for the professionals that I was interacting with. And and yeah, so there was an awful lot of disbelief in what I was experiencing. I think also because I was kind of articulate about it and able to describe it, that for some reason that meant that, I was making it up, and that my pain couldn't be that severe, right?
Yeah.
Like, it was out of
Yeah.
context. But
Yeah. During those
yeah.
10 years, like what was like what were things getting worse? Like what
Yeah,
happened
so
in that like
for,
25 to 35?
so in about 2008, so I would have been 30. Um, I went from just having period pain to then experiencing mid-cycle pain. And it took a little bit to figure out that it was actually cyclical in nature.
Mhm.
Um, and I would say it was 2 to 3 days of over my ovulation where I was experiencing what I would call labor. Like, it was excruciating front cramping and back pain. And again, with nausea, and this time with like a lot of bloating and constipation during that
Mhm.
that phase of my cycle. And there's like nothing that I could do would help. Like, I could take any pain reliever and it wouldn't touch it. The only thing that became my very best friend was my heating pad. Like, that was the only
Yeah.
thing that kind of took the edge off. And so that shifted. And again, I think I re-engaged with my family doctor, asked for a referral for an OBGYN, because I'm like, this is not normal. I'd done the research that said, mid-cycle pain or ovulation can be felt by some people, but it's usually just like a mild
Right.
sensation of like,
Not
oh, I have an
labor.
awareness, I've just dropped an egg, right? Like, you're,
Right.
yeah,
Right.
but not like pain that would wake me up in the middle of a sleep, in the middle of the night. I would actually wake up crying and then not know why I was crying. And then, like, when you're waking up and you're just coming
Yeah.
to, and you're like, oh, where am I? Right? Like, and I would
Yeah.
wake up crying, and then I would realize I'm in pain. Like, so much pain that even my sleep is is being disrupted.
Right. It woke you up.
Yeah.
I've definitely talked to people and personally experienced the ovulation pain almost worse than my cycle.
Yeah, wait, this is why I knew something serious, like even more serious was going on, because
Yeah.
that pain, like my menstrual cycle became like almost like a breath of fresh air, even though it was still painful. But
Right.
like it was in comparison, it was just by far nowhere near as excruciating. Yeah, so I engaged my family doctor, got a referral, and this was one of my first, I think, eye-opening experiences of, and I know other people have spoken about this, of ridiculous medical advice. So I feel like you know what's coming.
I have a list in my head right
Yeah.
now of what could
So
potentially you may say.
yeah, so that was my first foray into, you should have a baby. Babies and pregnancy can for some people cure your mid-cycle pain. So
Oh my
yeah.
myth. Everyone, that's a myth
Oh,
if you're
it's a
listening.
huge myth. Also,
Oh,
outside of the fact that it's a myth, I'm not sure on under what criteria suggesting something to someone that they may not have thought of before as a lifelong investment, a
yes.
child, but on
Yes.
some, and the cost associated with having, with bringing up children. So
Right. And
it's really,
everything. I mean,
yeah,
it's so
it's ridiculous.
inappropriate. It's so inappropriate. I
Very,
guess the
yeah.
inappropriate because you have no clue what this person may or may want even. What
But
it
that's my,
like
yeah, that's my point. But that was offered to me. So I think I was offered Toradol, so a
okay.
more powerful but
Yes.
pain medication,
I
and
really like
then
Toradol. I'm a fan.
yeah, I'm not. I mean,
Mm.
generally those haven't worked for me very well. But yeah, so I was offered Toradol, and I was offered, maybe you should try having a baby. And full disclosure, part of my history with my partner is, they'd had a vasectomy, right? So, and then we had gone earlier in our relationship, I'd gone through a phase of, like, we were looking to actually try to have our own children, and he'd had a reversal done, and it didn't work. So, and this was all history that the OBGYN knew. So she knew that the only way we could actually end up getting pregnant was through IVF anyway. So on top of
Oh
just like
my,
regular
so
old fashioned
insensitive.
pregnancy, yeah.
Yes.
So there's an additional cost to us for that recommendation of treatment.
Oh
Um,
my goodness.
yeah. I can look on it so compassionately now, but yeah. So that was about 2000 and like 8, 2009. I can kind of speed through. So 2011 to 2014, again, like age 33 to age 36, just increase in the severity of the symptoms. Again, mostly mid-ovulation. My cycle stuff hadn't really changed too much. But again, I think I noticed more GI, more bloating,
Mm-hmm.
um, and instead of it being like 2.5 days a month for the mid ovulation pain, and it was like growing on either side.
Yeah.
The severe, like the cramping and stuff, was still usually only like well, not that it felt limited, but it was limited to about 2 to 3 days of like the excruciating, like labor, like
Yes.
hour on the hour kind of
Yeah.
cramping.
Trying to
Um,
not pass out, rocking back and
yeah. Oh,
forth,
yeah. Yeah.
doing Lamaze breathing. So, but during this time, like this, how were you managing? Were you like taking time off work on the really, really
No,
bad
I was
days?
taking
Just,
911 calls with a heating pad on,
oh
answering
my
911 calls
gosh.
in the throes of having
Emergency.
my own emergency. I actually remember, and this was probably back in, you just made me realize, back in, I think it was 2010, maybe. I actually remember taking a 911 call and realizing I had just burst an ovarian cyst, because I was
Oh,
suddenly out of my chair on the phone, and I couldn't stand up straight. I couldn't sit down. I could just remember finishing that call and going, I have to go. And I
Oh
drove
my
myself
gosh.
home. And I remember I couldn't even lie on the bed without, like, I couldn't straighten my legs, right?
Right.
And so, but here's the rub for me is I was so, because of my career, and because of what I understood of the healthcare system that I was in, and because of my own experiences in the healthcare system at that time, I did not go to the hospital.
I understand.
I was only going to go if I knew I was actually bleeding to death. Like I knew I was going to have some bleeding in my abdomen and I knew it was going to cause me pain for about 2 or 3 days. But I was like, I knew what to look for in terms of my symptoms. And I was just like, unless I'm really truly about to die, I am not engaging in the healthcare system,
Or
which is
going to
really
like,
sad.
it's
It's very sad.
awful.
Yeah.
It's unacceptable that
Yeah.
myself, I've had a cyst rupture and haven't gone to the hospital, and my
Yeah.
husband was out of town. I was home alone. I was very scared, and I
Yeah.
got on literally Facebook Messenger with someone who was awake because I felt like I would be able to treat myself better at home
Yeah.
versus going to the emergency room where I would be dismissed, shunned,
Yeah.
whatever.
Yeah.
I just had a random question pop up. Did
Yeah.
you ever have a 911 call where someone potentially with endo or like an ovarian cyst burst or anything like that you can recall?
Um, I wouldn't say like nothing specifically comes to mind, but I would have no doubt like we get a lot of abdo pain calls.
Yeah.
But yeah, I definitely have had calls where, there was a gynecological emergency that wasn't related to pregnancy, for
Yeah.
sure.
Yeah.
Yeah.
It
Yeah.
just
Like
aside,
heavy,
like,
heavy bleeding and stuff like that, or like
yeah.
uncontrolled bleeding. And yeah,
Yeah.
often it was like fibroids, I think were usually what those ones were about.
Yeah.
But yeah, yeah, yeah,
Just curious.
yeah, for sure.
Oh my gosh. So
Uh,
you have this cyst burst. You're
yeah,
just in it. You're just living with the pain and pushing forward and just doing the best you can. This
yeah.
cyst burst, what happens next?
Well, the thing is, I'm just assuming a cyst burst. I
Of
wasn't going to
course.
go and have it
Yeah,
confirmed
I
because
get
my
it.
experience again up to that point was I would go and I would have ultrasounds done. And they would always come back and they'd be like, "Oh, everything looks normal. There's a number of cysts on your ovaries, but they're too small. They're so small that they can't be causing you the pain that you are expressing to us." So, really, when I look back at that and I think about what that actually said, that basically said, you're lying about your pain because the evidence that we see here is not matching your experience. Therefore, your experience must be wrong versus our ultrasound must be wrong, right? Like,
I think that is
eh,
that the definition of gaslighting right there. I mean, that
yes,
is like the
essentially.
exact definition
Yeah.
telling
It's the
you,
it's the stopping it's the stopping the collection of evidence at what you have in front of you as opposed to looking for more and not really correlating it to the patient's actual experience, felt
right,
experience. Right.
right.
Yeah.
Oh my gosh, Billie
So
Jo, I'm
I
so
had a, I had
sorry
so
though.
yeah, I had so much of that though for me that
Oh my gosh.
I almost became what's the word? Uh Not indifferent to my own suffering, but it was just like, what's the point of screaming it off the top of the mountains when no one's listening, really,
Yeah.
right?
Ugh,
So yeah, I got to about so in that 2011 to 2014 period after the 2008 suggestion of pregnancy, um, I had engaged a lot of specialists, and pregnancy was brought up again.
oh my
And again, at
gosh.
this point, so here's the interesting thing for me is endometriosis wasn't quite in my my thoughts because no, not one of those practitioners ever uttered that word
Right.
ever, right? So that wasn't in the forefront of my mind as what might actually be wrong. I just knew something was wrong. So yeah,
Right.
again, in that 2013, 2014 period, I was like, okay, I'll give this pregnancy thing a go, and went through all of and again, knowing that it would have to be IVF, went through
Mm-hmm.
all of that because I was in so much suffering that I was like, I will do whatever it takes to not have this pain.
Right.
Right. So, yeah, was about to start had gone through all of it, like all the testing, all the blood work, all of the invasive testing for IVF,
Right.
and was about to pull the trigger on my first round of hormones, and then I got really, really sick. Um, and I really, in hindsight, recognize it was a psychological injury at work that was resulting in a lot of inability to cope with stressors, and my immune system was shot, and so didn't end up doing that treatment. And so I left. I gave up again. I've all these cycles of just, hitting a wall with the pain, and then engaging the medical system, hoping that it would be different, and then giving up again, and then
Yeah.
hitting a wall of pain, and then
Yeah.
do it it was a yo-yo. So,
But what were you supposed? I mean, you hit this wall. What are you supposed to do? I think
it was
sometimes it's
just,
like,
I think I just decided to I was like, obviously this is my life. I'm
yeah,
just going to suffer. Like I just kind of gave up
yeah,
essentially. And so it was about 2017 now, and I'm 39 at this point.
mhm,
Um, I was, the pain was so bad. I would almost call it like the dark night of the soul. In those throes of pain, in the middle of the night especially, I would wake up and I would actually wish for God to just let me die. Like it wasn't like I wanted to commit suicide, but the pain was so bad in those moments that I was just wishing for death. Death was the only way out, and for me. But then again, I would know, like, this is only going to probably be 2 or 3 days. I can do this. I can do this. I can do this. And some of those, it was mostly at night, it was really bad, but then it was like during the day, the cramping, and it was like every hour I'd go out for a walk and I'd be humbled to my knees, and I would just be on the ground in public on my knees in the middle of a cramp, and it would last like 10 or 15 minutes, and then I'd get up like I feel fine, like, and so yeah, I engaged an OBGYN because I was like, please help me.
yeah.
Again, ultrasounds, everything was normal, and this was the one time where I was prescribed, at least not pregnancy this time, because I had said no.
Oh my
um,
gosh.
this was the Lupron.
Oh no.
Yeah. uh, I can see your face right now, and
Yes.
yeah. And again, that was really bad advice, not appropriate treatment again, but the endometriosis word was never uttered. I was never actually diagnosed with anything. I was just given a treatment to help me with my pain, right?
Wow.
And actually, so I'm just going to move ahead
Yeah.
to my surgery date, and then realize I had to go back and look at some information. And I found an ultrasound report from 2017 that actually showed I had a number of fibroids, but I was never told. I was never told that I
Oh
had them.
my
I actually just found an
goodness.
old ultrasound report, and I was like, wait a second, why didn't anyone ever tell me? Right? It was more like the patient doesn't need to know what's actually wrong with them. They just need to know what the treatment is, you
Oh
know?
my good. Right. Right.
So,
Because if they would have told you that, it could have sent you down another path.
oh, I would have
Research and
been,
yeah.
yeah, again, for me. So that was a bit of I just learned
Oh
that like in the last few months, and I'm kind of angry about it.
yes. As you should be.
So I did one round of Lupron. It was hell. It was awful. I stopped, and just to backtrack, in between that whole time frame after stopping Depo and up to about 2017, I did do the other treatment that's recommended is birth control, right? So I
Yeah.
had tried a couple different birth controls, but they just never ever agreed with me ever in any way. It just was
It's very
awful.
common with a lot of people. Some people I talk to, they say, "Oh, it did help me a little bit," but very common with endo patients.
Yeah,
They and I think, and
it
again, not a
I can
medical
under I
doctor.
can no, I can understand why, right?
Yeah,
Because
because
if you have endometrial like cells outside of the uterus that are hormone signaling, usually with estrogen and progesterone, you're going to have more free roaming hormones in your body. So birth control is going to have a direct effect on that. So yeah, of course, it would make sense that the experience of many people with endometriosis would not do well on a hormone therapy.
Yeah. Makes
So,
a
yeah.
lot of sense to me.
Yeah. So I did the Lupron for one season, one round, and I was like, never doing that again. And then I gave up again. Right. I was like, I'm done. I can't do this anymore.
For people who are listening, Billie Jo, can you tell us a little bit about your experience with Lupron and why you stopped it? Just because there may be people listening that are potentially considering that treatment. And we haven't talked about it a lot. So if you're willing to share why you stopped, that would be really helpful.
I mean, it was twofold. First of all, it catapulted me into a mood spiral that I've never known possible. And it was like immediate. And yeah, I was just really, really sick, really nauseous from it. Again, just a full increase in pretty much all of my symptoms. And then I just started doing the research, and I was like, this is not good for your bones. This is not a good solution for the treatment that you've recommended it for, right? Like I'm pretty sure I know there's research studies on the like bone density loss, like sometimes within only 1 year of use, like significant bone loss and an extreme increase in your risk of osteoporosis. So
some people I've talked to said it didn't even help. So
it didn't do anything. Like
so that was my next question.
It was like adding gas on the fire. It actually made things worse for me. So and I wasn't willing to, try it for 3 or 4 months to see if it might benefit me. I was like, I just can't. I'm done. So I was done.
And then when you were researching Lupron, did endo come up at all?
Not really. Again, because it wasn't like, even like back in 2018, it wasn't, or 2017, it wasn't really on the radar so much. Like it was not, at least certainly not on my radar. It didn't come up in any of the research I was doing. Like even looking up mid-cycle pain, I don't even think adenomyosis came up when I was searching mid-cycle pain. Like back then, searching mid-cycle pain, it was like, this is normal for some people. And so I gave up again, moved to the West Coast, again hit a wall with the amount of pain, and sought care through my general practitioner, sent me for ultrasounds, and again, it just showed cysts, but again, they were too small to be causing the problem. And I kind of left it at that again. And then I moved out to where I am now on the East Coast in Canada. And it was like 2020. I was on a wait list outside of this particular issue. Healthcare in the province that I'm in, waiting list just for a family physician can be upwards to 2 years. I was really lucky. My partner and I, it was about 8 months of moving to the East Coast, we got a family physician. And so like one of the first things I did, here's my history, here's my other medical issues. Can you please make a referral to an OBGYN? And at this point, endo was on my radar. And I was like, can you make sure that they're an endo specialist? Like they're an OBGYN that specializes in endometriosis. So that referral was made in May of 2022.
Okay.
I'm still waiting for it. That hasn't happened. No. And so I can fill you in a little bit on that timeline. But again, it was one of those things like, I definitely had been doing more research at this point, and I was in that position where... How did
endo come across your radar? Sorry to interrupt you.
I remember actually, I I don't know exactly. I actually I did find an email from 2013 that I had sent to my partner. It was a research, and I just found it today. Um, I actually did have it on my brain. It was just kind of like floating around in there, and
Right.
like, yeah, but because I had sent him an article, a medical, because here's the other thing too. I wasn't just looking at the whatever Google had. I
Right.
had access to medical journals, right?
Right.
Because of my,
Right.
my schooling and
Right.
education, and so I was actually looking up research papers.
Right. Right. Right.
So
Right. Right.
I
Right.
imagine it probably came from that, to be
Probably.
honest.
Yeah.
Yeah.
Oh my goodness. So at that point, did you feel like this is probably what I have? I
Oh,
mean,
yeah, I was pretty sure.
once you
And
started
again,
to
I've had,
read about
yeah,
it, it's like,
yeah,
oh,
yeah. So yeah,
okay.
yes, definitely. And I asked for that referral. Um, and again, I'm still waiting. I did look at how long it's been. It's been 1 year and 10 months today. I'm
Oh
still waiting
my
for my referral.
goodness. Oh my
Uh,
goodness.
and so in and around that time, again, I'd hit a wall with the pain, and I knew I wasn't getting anywhere with the regular medical framework, Western medical framework, in terms of
Mm-hmm.
like OBGYNs and
Yeah.
whatnot. So this is when I started engaging in, if I can't get a diagnosis and I can't confirm what's going on, really what I have left is my own body and what I can do for my own body.
Mm-hmm.
Right. And that was, and I, medicines for me weren't working. Birth control didn't really work. I actually don't like putting that stuff in my body anyway
Yeah.
anymore. And so that I started to engage like osteopaths and physiotherapists for like pelvic floor physiotherapy. And I had a book that was suggested by my pelvic floor physiotherapist, um, called Beating Endo. I'm not sure if have you read that
Yes.
one?
I haven't
Okay.
read it, but I'm familiar
Oh
with
my
it. A lot
gosh.
of people
Okay.
have read that, and I heard it's fabulous.
That book broke me. I, it was the first time, aside from like my physiotherapist was like, "Oh, I totally think you have endo," right? Like,
Yeah.
it was the first time I read a book written by a physician that saw me and validated me and understood me. I'm reading this book, I'm like, "Holy shit. This is me. Like,
Yeah.
this is me. Like, I'm finally being seen." And
Right.
I remember just reading that book, and in the fetal position, breaking down. Like, I would read a chapter and I would break down, and I would cry for sometimes
Yes.
hours, because it was
Yes.
like, I was like, finally, 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 finally. So it was a book.
Well, and it was, oh my good, like it was, I need to read it. It's on my
Yeah,
radar.
yeah.
Because I've heard very good things about it, but it was finally, yeah, you were reading
I was
something that
validated.
was, yeah. Yeah.
Someone actually saw me.
Yes.
And so it was the
Yes.
first time I saw myself very clearly written down on the page. I was like, this is my experience.
Right.
Yeah, and the book also, like, there's a lot of stuff in the book that talks about what you can do for yourself, because I think that it's very well recognized that we're in societies that
Right.
dismiss the
Yes.
experience of many people having
Yes.
these experiences. So it was very validating from that standpoint, but it was also, it was almost like it lit my fire again, where I was like, I am done. I
Good.
realized in that moment, I was like, why am I suffering? I don't need to suffer. There's no point in my suffering, because there's things that can actually be done. Like, you can
Yeah.
have the gold standard surgery, and for the most part, at least either have it removed, like you could be in complete remission, or have some grace for a few years, right? Like,
Yes.
so it was really the first time where I took my own advocacy, my patient advocacy, outside of what I thought the limitations were for me.
Yeah.
Right? I'm like, I live in Canada. I have to do this. I have to go through OHIP. I have to go through the referral process. I have to do this. I have to wait, 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 wait.
Right.
I'm at this point 44. I'm so overdone on waiting.
Yes.
Like I was just done. I
Yes.
wanted my life back.
Yeah.
My quality of life was deteriorating quite significantly. So I can kind of catch you up to the symptoms at this point because they got much worse and much longer. My life became 7-ish good days a month.
Yeah.
That's
Yeah.
it. And those good days weren't always great.
Right.
But the I was my bowel issues were significantly increasing. I would have bowel movements, so I would still experience explosive diarrhea, period,
Yeah.
at my period.
Yes.
Ovulation, it wasn't actually constipation, like the fecal matter itself wasn't dry or anything like that,
Yeah.
but I would go to have a bowel movement and I would have to like brace. I would hold on to the sink, hold on to the bathtub, and I would scream. Like it was like I was delivering razor blades out of my
Yes.
rectum.
Yes.
And I was
I
like,
mean,
this is not okay.
that is
Not
not
normal.
okay, and
It's
a
not okay.
very good description. Not that I want
But
to
it
chuckle, but
was
that's a good.
it
People
is
need to
because
hear it.
it was like someone took a hot iron razor poker and was just like whoosh,
Yeah.
all the way through. And I just remember again talking to medical doctors and they're like, "Oh, it's just constipation." I'm like, "It is not. My poop is fine. The poop itself it's a lovely texture, it's a beautiful color. That's perfect. Nothing wrong with that." It's like and you know what, I do find that part really disturbing because I know that that's the experience. People, when they try to explain it, they're like, I'm not constipated.
Right. Right.
But it's like you're giving birth to a fire poking razor.
Yeah.
And like but it'd be so bad that like I would almost pass out. I would scream out
I
loud,
know.
like
And I'm
scream.
sorry to laugh because your
Yeah.
description is it's funny because it's
It's a
true. Like
it's a
that's
monstrous fecal baby that you're
yeah.
delivering. Like, and it's like
But
painful.
it is so painful and it's so
Yeah.
unacceptable that we are
Yeah.
allowed to get to that point
Yes.
ever.
And
Ever.
like that's normal. Oh, that's totally
That
fine.
is
Oh, if it's
yeah.
only happening once or twice a month, no biggie.
That
Just
is
yeah.
not normal. Yeah.
No, it's
Okay.
not.
Okay. So your symptoms are
Yeah.
getting just, I
Yeah, and
mean,
like
quality of
endo
life.
belly, definitely like swelling in my abdomen.
Yeah.
Urinary issues had started. I noticed them over the course of probably a year and a half, and they were just kind of like, really, you start to notice them more when they're like right in front of your face. You're like, why does it feel like I'm going to pee like every 30 minutes and I
Yeah.
don't have a UTI? Why does it
Yes.
hurt? And so one of the biggest things for me was I call it like rebound pain. So I would urinate and then my bladder would empty, and that the stretch of it moving back to its normal empty size would cause excruciating pain. Like 5 to 10 minutes of awful cramping every time I went pee
Like a
during
spasm.
my
It was like
yeah.
having a spasm.
Yeah. Yeah. But it's normal for the bladder to basically expand and contract like that. It shouldn't hurt though.
Right. Right. And
Like
this is, I
it's not
mean,
supposed to hurt.
and it's after too. It's like, okay, you've left the restroom and now you're almost like doubled
Yeah.
over. Yeah.
Yeah. So I would have these periods of like in between satisfaction where my bladder felt good. Like,
Yeah.
so if it was completely empty, it would hurt. If it was completely full, it would hurt. And then once I would empty it, I would get that rebound pain. And that was happening all the
Oh my
time.
goodness.
And then again, the frequency of urination during that time of my cycle was increasing. Yeah. And then just, I mean, outside of that, quote unquote normal was painful penetrative intercourse. That had
Yeah.
been part of my repertoire of experiences pretty much right from the very first time I ever engaged in penetrative sex.
Yeah.
So I again was just like, that's normal. I had a
Right.
tipped uterus. Also, it had the anteverted uterus, which is tipped forward.
Mm-hmm.
And I was told that was normal. It's normal for some people. And I was like, I don't think it is actually. Like, again, in hindsight, knowing
Right.
what endo does with the adhesions,
Right.
and it's like, no, this is why I have
Right.
this. This is why intercourse hurts so bad.
Hurts. It's right. You have
So,
something
yeah,
pulling on you, on your
yeah.
uterus.
And then mid-cycle penetrative intercourse would be even more excruciating. Again, it was like my uterus was on fire.
Yeah.
Right. I would have intercourse, and then I would sometimes spend an hour or two in excruciating pain, which really makes sex not so fun and not something that you generally look forward to if you know what the consequences are. Right. So it really does have a massive impact on really every aspect of your life, of my life.
Every aspect of your life. I
Yeah.
mean, every aspect. I mean, it
Yeah.
is, it is not, and because we're recording this in Endometriosis Awareness Month. It's not going to go live in March, but
That's
I'm just seeing so many posts because of it, and it is it's a systematic disease. This is not just something that an OBGYN treats. This is it affects your whole life, your whole body. And that is such a huge misconception too, that limits the awareness and the caretaking of this disease.
Yeah. Yep. Actually, it's funny you bring that little part up about, because I think specifically in Canada, I think it's a little better in the States. It's still predominantly treated and managed and diagnosed by OBGYNs.
Same.
They don't have a lot of multidisciplinary teams out here like they do in other parts of the world.
Yeah, it's probably better here, I would say, but it's still.
I think it's a little bit better just based on like my research.
Yeah, but it's still, grossly lacking. Like pediatricians should be diagnosing this in teens.
It should be
and
more
pre-teens.
than 2 pages or 2 paragraphs in medical school as well.
Yes, your family doctor should be able to know what it is when you say the word.
Your OBGYN should actually know what it is and should know the appropriate treatment.
Every doctor should know.
We can get into that because I definitely have a few
GI
stories.
doctors. Okay, yeah. we can go down a whole path. All right, let's wrap. Okay. So you're really like,
I'm
things
done.
are not.
I'm like advocating for myself at this point.
You're fired up. I've read the book. You're like,
I joined Facebook groups. Nancy's Nook for one.
Mm-hmm.
And I started listening to podcasts like, The Cycle. I can't remember how I came across your podcast actually now that I think about it. I would imagine someone must have recommended it to me, or I don't remember. I know I have subsequently recommended it to other people. But yeah, like your podcast kind of came into my life as well at around the same time as the book and Nancy's Nook. And then again, my nature of like really doing like deep research, like big giant dives into the data, into who knows what, and really just engaging myself in as much knowledge as I possibly could, because I was just so done listening to doctors tell me what they thought was the right thing. So I was like, I'm going to just go do my own research and find out for myself. Thank you very much.
I feel like when you get to that, it's so eye-opening though, because I remember the first time I diagnosed myself with endometriosis via Google. And then I found Nancy's Nook, and then podcasts weren't that big when I figured it out. And I, like you, I started reading papers, medical journals. I was just, I went down such a deep rabbit hole, and I was so happy, but at the same time, I was so mad.
It's so frustrating too.
Yeah, I was so upset. I was like, how could I figure this out? And these people that I've been literally begging to help me not be able to figure it out. And then, but it was so rewarding to like find this community and people, and there's all these other people going through it, and they give you advice and they help you. And it was so, and it all kind of hit me in the face at the same time. Sounds like same
Yeah.
with you. Like you got the book and then all of these
Yeah.
other things, and it's just, it all clicked.
Yep. And I
Yeah.
think part of that clicking is also like really, it's so challenging to advocate for yourself when you've been dismissed over and over and
Yeah.
over and over again, right?
Yes.
It's interesting. It made me think of this study, and I could find it and send it to you unless it's already been on your radar. It's not specific to endo, but it's very specific to the experience of many women, female presenting persons. I think it might have been a Canadian study, might have been an Ottawa hospital, and it was like ER visits. And I can't remember if it was a specific chief complaint. It might have been like back pain, but it could have been like anybody just presenting with pain, let's just say.
Okay.
But it was a study done on what treatment was given to you already know where this is going. What treatment was given to a female gendered person for pain, and what was given to a male gendered person for pain. So I'm just going to, just for ease of argument, you can post this in your notes. I can find the article.
Sure.
Let's just say it was back pain. Let's make it easy.
Yeah.
So the female gendered people complaining of back pain were given an anti-anxiety med. They were given generally like Ativan, which is lorazepam, right?
Mm-hmm.
For their pain. The male gendered people that were coming in complaining of the exact same thing, of pain, were given analgesics, which are actual pain relievers. And it was such a significant, obvious, discriminatory behavior. And again, so my experience in the healthcare system has been, I would say, extra saucy in the dismissive department because I present female. And
I'm so
yeah.
like when I hear these things, I knew I could have guessed where you were going.
I could tell by your face.
I'm just so,
Yeah.
I know I have a really bad, like I
But
can't
they've
hide.
done
I don't
the
have a
thing
poker
is
face.
they've done the research, so they know that bias exists, right? And so again, so for me to reignite my vulnerability, really, the vulnerability to reach back out to the
Yes.
medical profession to seek help. But this time I did it outside of Canada.
Okay. Okay.
So it was February of 2023.
Okay.
I'd kind of done my Nook research. I'd looked at cost was prohibitive for me to some extent, right? So like coming to the state, no offense, coming to the States and paying for a surgery was mostly out of the question for me because it was more expensive.
Yeah.
But I did a lot of research, and I came across the Bucharest Endometriosis Center in Romania. I know a lot of Canadians have gone there. It's unfortunate, actually, if I understood it, their stats, 30% of their surgical cases are Canadian, which is astronomical. Yeah. So here's the thing, right? And I know this is a fairly similar experience in the United States. You don't ever get to directly speak to a physician. You don't ever get to directly speak to a specialist, never mind, unless you've had the referral. You know what I did? I emailed the center and the doctor directly. His email is there, and I emailed him, and and he wrote me back. And I was just like, holy crap. Like, he actually wrote back. And he said, I know my first experience with him was like, oh no, like, he's like, it sounds like you have endometriosis. So right out of the gate, it was the first time a physician had actually said that to me. I gave him a synopsis, not dissimilar to the timeline I've provided you.
Yeah.
About my symptoms and when and all that stuff. And he's like, well, it sounds like you have adenomyosis and endometriosis. And I was like, okay.
I have chills.
And then he says, but you need to get an MRI first. And I was just like, no.
You're like, that's going to be really hard.
It's
I'm
going to
in
be really hard.
Canada.
And so I already knew in Canada that it would be a long time to wait and that they don't do an endo specific pelvic MRI. It's not read. So here in Canada, it's read, like those results are read by a radiologist.
Right.
They give the report to the specialist. The specialist very rarely actually looks at the images themselves, right?
Yes.
And so they just rely on the report from the radiologist. So I was just like, even if I did get one here, it's probably not going to show anything. And so I had a moment of like, I was disappointed.
Yeah.
But then I wrote him back and I said, MRIs here suck and I'm going to be waiting forever to get one. He's like, well, just get one here. He's like, we can schedule you for a consult, an MRI, and surgery within 2 weeks, within like a 2 week period. Like,
right.
And so here's the funniest part. He's like, I just want to apologize up front that we have about a 6-month wait time. And I remember reading that to my partner and hysterically laughing. I was like, 6 months? That's nothing.
Great.
Oh my God. Sign me up. I'll be there. So between February of 2023 and June 26th, I had reached out to a specialist, heard back, planned a MRI, planned a consult, planned a surgery, and planned a trip to Romania.
Wow.
Yeah.
So this is a very helpful tip, I think, for people who are listening in anywhere, any country, Canada.
Yeah.
Wow. Okay. So you probably felt at that point so validated.
I was also like, is this too good to be true? And then all of the doubts start coming back. Like, what if they don't find it on the MRI? What if they do the whole surgery and there's nothing there? And the funniest, well, I don't think it's funny. It's fascinating to me because of the experiences that many of us have had, including myself. I gaslit myself.
Yeah.
I was like, I did. I was like, what if they shouldn't have to find anything. Like, it would be good if they didn't find anything, but I'm wanting them to find something because I'm like, I need to know. Like, and I was so afraid to be told, sorry, there's nothing there.
Yeah.
Right. And then I'm like, then what? Then what do I do? Like,
it's such a valid fear, though. You're not alone in that. I hear that every single day. I felt the same way too.
Yeah.
And that is not our fault. Right. You're right.
No.
You should want them to not find anything, but you feel so awful and it's been so long. You're almost like they better find something.
Yeah. And I just remember there was a very deep fear of, what if it is all in my head?
Yes.
I mean, there's an absolute component to that, right? Because we can't separate our mind from our body in terms of how our body manifests the stress and all of those lovely things. But the way that they sell it's all in your head it's not a healthy way to sell it.
Correct.
Correct. So yeah, it was exciting and terrifying. And I think I'd like to just take this moment to acknowledge my privilege in this moment, though, for me, right? Like, I acknowledge that I was advocating for myself, but I had the capacity to do this trip. I had the capacity, not that it was not inexpensive, and I'm certainly carrying the cost of that, but I knew we could, my partner and I had the enough resources to be able to actually afford to fly to not that we should have to, but I was able to. And I know that there's a lot of people that can't do that. And that's part of my advocacy is, supporting organizations and GoFundMe's for people that can't afford the surgery and are trying to be able to afford it. But yeah, so I'm very grateful for that, but I do acknowledge that as a privilege of mine. So yeah.
And that's really hard. I mean, I think about that very often, about how lucky and privileged that I am. I can't imagine if I didn't have the capacity, what I would do. And I agree with you, supporting the GoFundMe's, but at the end of the day, it has to be something that is recognized and treated in a
It shouldn't
timely.
have to come to my privilege.
Exactly.
Really.
That's the bottom line. Is
Yeah.
that it needs to be recognized and treated
Yeah.
and in a
Yeah.
timely fashion. I'm sorry.
Yeah.
2 years is unacceptable and you still haven't
Well,
even seen the doctor.
No, so I don't think I've actually stated this outright, but from initial symptoms, because painful periods are not normal. So my day 1 to surgery date and actually getting a valid, accurate naming and diagnosis is 31 and a half years. I went 31 and a half years without a proper diagnosis.
Yeah.
And suffering the entire time.
And you didn't have to.
No, I didn't have to. Right from the get-go, I didn't have to.
Yeah.
But certainly from about 2008 onward, that's like 17, 18 years of just gradually suffering,
Right.
like to the point where I didn't want to live anymore.
Yeah. Yes.
Definitely didn't have to do that.
Yes. And
yeah.
Right. And all the Lupron and the birth control, like those things potentially may have not had to be done if someone.
No, and they really probably wouldn't have worked either.
Right.
So,
and they didn't.
They didn't. Yeah. So it was the first, albeit I was scared to be that vulnerable again with the medical profession. But it was one of the first validating experiences I had directly from a physician. I've had some really good physicians over my lifetime and some really terrible ones. We tend to remember those ones more than the good ones, but so we kind of saved up and packed up and left on June 23rd and flew out to Romania. And then I went to they have, I can't remember her name, Dr. Lisa something. She's the radiologist and she's like almost world renowned for doing one of the only, if I'm not mistaken, endometriosis specific MRI. So she's got her own protocol. And it involves inserting gel into both the rectum and into the vaginal cavity for the MRI because, again, the rectum, it's always contracting, right? So when you fill it, it creates less distortions in the MRI. So the image quality is a lot better and it just moves things out a bit more to give a better picture. So that's why they do that. And then the same with the vaginal canal. It helps push things out of the way, like it moves the uterus a little bit. So it's a very specific MRI. And here's the other funny thing. Again, it was so interesting because, again, my own personal experience as a patient in the healthcare landscape in Canada, but also as a former paramedic and 911 operator. Like I've been in plenty of hospitals as a healthcare provider, and so I'm very familiar with just the general experience. And so it was interesting to me out in Romania, the radiologist herself did the scan, also inserted the rectal gel herself. Like they would never do that in Canada. They'd be like, no, that's for the radiologist tech.
Yeah, right.
That's below me.
Right.
It's below my pay grade.
Yeah.
But they were there the whole time. After the MRI, I was just like, I was expecting to just go home and like to the hotel or Airbnb we were staying at and like wait to hear back. And she's like, oh, just go sit in the room for, and I'll review the scans and then I'll call you in. I'm like, what? What do you mean you're going to, what?
Wait, I'm going to find out now what you find? I don't understand.
And I'm going to find out from you? You, the doctor? You're going to, and so conveniently my partner had just ended up needing to go to the bathroom when she called me in. So the first few minutes of her going through the scan was without him. But so the first thing she did, actually prior to, this is the other thing, a radiologist would never do this in Canada. So prior to the MRI, she sat down across from me in a private room dimly lit room with a tech, and just sat there right across from me and just asked me my history. And I think when I said it's been 30 years, she almost cried. She's like, "What? I don't understand. Like, this is not okay." And so again, very understanding, very validating, not dismissing a single symptom of mine, not saying, "Oh, that seems out of context," or, "Oh, that sounds like it's way too much pain." Like, it was just like, "I'm really sorry you are experiencing this."
Yeah.
Like, yeah, so took a fairly detailed history, because you know what the history helps her do? Look more closely at the scan in certain areas.
Yes. Yes, of
Right? Like,
course. Of course.
so yeah, had the scan, called me back into the same room, put the scan up on the screen, and first, before she said anything else, she's like, "I just want to let you know, you have endometriosis."
I'm about to cry.
I'm
Just
gonna
hearing
cry
that.
right now, because I brought Kleenex just in case. Because yeah,
Yeah.
it's the first time someone other than me said to me, "You have endometriosis." And then she said, "I'm going to show you where it is." And so she,
I love this. I love
I
this person
know,
so much.
she's so good. Um, she went through the entire MRI with me, and then my partner, his name's Scott, by the way, he came into the room, and I actually said to her, I said, "Oh, can you go over this all again for him?" And normally they'd be like, "I don't have time for that," and
Like,
she's like, "Yeah, of course, of course, of course, of course." And she said, "Yes, you definitely have endometriosis." She said, "You have fibroids. You have multiple fibroids in your uterus." And she said one of them is so, she said it's inside the muscle of it was an intramuscular fibroid that was actually compressing my cervix. So it
oh
was
my.
it was narrowing my cervix, which also explains the painful intercourse.
Yes.
So yeah, and it was basically impinging on my cervix.
Oh my
Um,
goodness.
yeah. And then they also, and this was like one of those moments for me, she's like, "Also, your bladder is adhered to your uterus. They're stuck together." And I was like, "Well, that explains all of the,
Yep.
during mid-cycle pain, why I was having
Yes.
all of these UTI symptoms."
Oh my. Yeah, right. You're like,
Yeah.
yes, I could have told you that was probably the case.
Yeah. So
Wow.
I have my report here, actually.
Oh my
So
gosh.
this is my whole medical report. But the MRI showed the tipped uterus, anteverted
Hmm.
uterus. And it showed, let me see. So yeah, so fibroids are basically called leiomyomas, right? And so depending on where it is, it will indicate where in the uterus it is. So I had a subserosal leiomyoma, which is basically a fibroid. And then I had it's called an isthmic intramural leiomyoma, which is the one that was inside the
Okay.
inner layer, and it was compressing and impinging on the cervix. I had a whole bunch of cysts, microcysts in my cervix as well. I
Wow.
had like lots of adhesions were found uh, in my peritoneal cavity, my abdominal cavity. And there was deep endometriosis in the bladder area, or what appeared to be.
Yeah.
And then both, like, bilateral uteral, I know the uteral sacral ligaments tend to get a lot of endo, and so
Hmm.
mine were significantly thickened, and it was a sign of like really deep infiltrating endometriosis, um, on both sides, but predominantly on the left. I've had 3 hip surgeries on my left hip, and I'm wondering now in hindsight if I needed any of those at
Oh
all for what
my.
I was having it done for.
Yeah. Because if
But
something was pulling over there and just the
yes, I mean,
nerves and
I had an injury, and I definitely had a labral tear there, but I think
right.
significance of the pain I was experiencing makes more sense now that I know what was going on down there. And then, I had some endometriosis in the round ligaments. The funniest thing is, aside from a few cysts in my ovaries were in great shape, which is a blessing, because I know that, a lot of people experience that endo being really severe with the ovaries.
Yes.
And then just one of the symptoms I hadn't really talked about too much, aside from saying lower back pain, would be sacral pain. Very specific sacrum pain, to the point where it was just a 24/7 thing. Like, my sacrum was just on fire all the time. Like, it burned every single day of my life for the last 5 years. So it's easy to not talk about it because it's just something I was dealing with all the time.
You were just used to it at that point.
Yeah,
it was normal for you. Normal.
Mid-cycle, I wouldn't be able to even bend over and hinge at the hips to even touch my toes. The pain was so severe. It would limit my ability to bend over.
Yeah.
So that was actual evidence, right? So then I knew I was going into the laparoscopic surgery with actual evidence, right? Whereas I know a lot of the experiences, it's a negative MRI, and then you're waiting to go to the surgery to have them say, "Oh, whoa, we found all of this," right?
Right. Yes.
Yeah.
That feels like a nicer way to go into surgery. I mean, just knowing that
there was stuff there.
Yeah.
For sure.
Yeah.
Right. And the interesting thing is, I had a pelvic MRI. When was it? I wrote it down. I had a pelvic MRI in 2020. No, a pelvic CT scan in in 2020, after I moved out to the East Coast. There was no mention of adhesions or that my bladder was stuck to my uterus.
Or fibroids.
What about fibroids? Those were not there.
Wow.
So
I mean, you bring up a good point, because going into surgery, you knew, but so many people go into surgery, and when they wake up, they say, "Did I have endometriosis?"
Yes, I've seen so many just heartbreaking videos of people waking up from surgery, and either their parent or their loved one or the doctors telling them, and they just again, it's that that validation of, I'm not fucking crazy.
Yes.
I knew I wasn't crazy.
100%.
Y'all have been trying to tell me I'm crazy for 30 years.
Can we get that Romanian MRI technique here in North America?
Yeah, I actually talked to her about that. And I know
so they can do it when people are feeling ill at 16, 17, 18.
Yeah. Yeah. And the thing is, it's not that much of a difference in the procedure. It really comes down to the education of knowing what to look for.
Yeah.
Right? It's always been there. It's definitely been there since 2017.
How to look at
for sure.
For sure. How to look at it. Okay, so tell me about the surgery. How'd the surgery go?
For me, I have a few other medical issues, so there was just, a few extra hurdles to jump through, like seeing a cardiologist. They were very thorough. They listened to me. They actually took my advice when I said, I need to have this when I'm being put under. I react to anesthetic for this reason, so we need extra fluids. You need to give me more fluids than you think I need. And they're like, yes, 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 yes. And I was like, I will need more pain initially, because again, I have a couple other conditions and it's going to affect my blood pressure. And so they took that all at face value, and they're like, okay, well, because you've said this and because you have this condition, we're going to have you see the cardiologist first, just to make sure. We're going to have you see the neurologist first to make sure. We're going to have you meet with the anesthesiologist team. And I was like,
amazing.
Okay.
Amazing.
Okay.
Amazing.
Yeah. And then, this whole entire time in between my initial contact with the surgeon himself, Dr. Mitroy, I hope I'm pronouncing that correctly. I've never had a physician on WhatsApp. Like we were communicating on friggin' WhatsApp. Like in the middle of the night, sometimes he's like, "Hey, like listen." He's like, "Your surgery's tomorrow. Can I give you a call?" And I'm like, "What? What do you
Gosh.
mean you want to call me?"
You're sure. What's
Like,
up?
okay.
Doc?
But I even had I had the anesthesiologist
Wow.
on WhatsApp, and I was sending like medical files just like on WhatsApp, and it was a surreal experience.
So
They
different.
definitely,
Just
yeah,
so
it was so
different.
different. Also, just like from a modesty perspective, it's so different than America. Like, when you go into an office and you're having an exam done, and they're like, hold on, not only are we going to leave the room while you get undressed, we're going to put this curtain over here and we're going to leave, and then we're going to knock on the door and be like, are you ready? Are you done? Right? Like, and then they're coming in, they're like, gingerly moving to things. I went to the cardiology appointment and they're like, take your shirt off. I'm like, just sitting across from you? Like, yeah, just take your shirt off. I was like, okay.
Okay.
And I remember after my surgery, I was out of it for like 24 hours in the ICU, doped up pretty heavy.
Yeah.
They did not mess around with that either. Whereas in my experience in Canada, I overheard a nurse after a surgery talking to another nurse about how I was drug seeking because I asked for pain relief in the post operative suite, like
Yeah. Come
after
on.
surgery.
Yeah.
Like so, um, yeah. So I guess in the cardiology assessment, it was just sitting across from like at a desk, like you're at the principal's office or something, and they're like, they're like, take your shirt off. I'm like, right here? Like, I'm not gonna go behind a curtain and sit on an exam bed. They're like, no. And so I'm just like, whoosh. I take my shirt off. I'm also beside my partner, which I mean, it's just fine. But it was just, it was a strange experience. It was actually kind of refreshing, to be completely honest. It was just unexpected. And then
Right.
in my surgery, after I was in like an ICU post-op, and it was like an open ward in Romania, and yeah, I pooped myself. I couldn't feel my genitals. They were frozen, right?
Right.
So I
You
had
were
no
still
idea.
under
And
anesthesia.
yeah, so the nurses came by, and I can't remember how they said it, but they said, I can't, it was like you had an accident or something. But like right in the open with doctors walking by, and like, no, they just like whip off all of my, like, there's nothing. I'm just like completely naked. Just, I felt like a baby. I was like, I was just born. I was like naked lying here. Um, like even the sheet transfer when like moving from
Yeah.
the ICU bed, they like completely naked, and they're just like,
No big
moving
deal.
over.
They're
No
just
big deal.
used to it. Yeah.
They are
Here,
used to it,
we
and it
are
was
so
interesting.
modest. We are very
And
modest.
and I found that it's so, and the other really fascinating thing for me, because I'm very observant, I'm always paying attention, right? Is the way that they care for people is not really the same as they do in North America, where it's like very touchy-feely. But I think they knew where I was from, and so they knew I was having a challenging time with pain. And the one nurse came up to me, and she like did this like kind of like just like patty. She's like, I think this is what you need. And for me, it was less about the act itself, but more of where it came from for her. And I was like, that's beautiful. Like
Yeah.
she's showing me that she cares in her own way. It was
Right. She
cute, but yeah,
recognized
she
that.
recognized what I needed.
Yeah.
Yeah, it was sweet. Okay, so surgery. The day of the surgery. So the night before, this is a procedure that I don't know how much. I don't know if I've listened to almost every one of your episodes.
Well, thank you.
I don't believe pudendal neuralgia has come up very often or at all.
Nope.
Okay.
Never heard that word
Okay.
in my life until
So
you just said it right now.
yeah. So there is some crossover between pudendal neuralgia and endometriosis, because so the pudendal nerve is the bundle of nerves. So it comes out of the base of the sacrum,
Mm-hmm.
and it comes in through the pelvic girdle, and it comes down. It like breaks into three different branches, and it supplies the nerves to your genitals, to your bladder, to your rectum, and three different types of nerve sensations. So feeling, temperature, and like reaction to things. I'm not going to get too medically
Yeah.
on that, but so he had done a couple assessments, and based on the sacrum pain as well, he was like, I'm pretty sure you have this as well. And so he's finding it a lot in his practice as an overlapping symptom, because what often happens is the most pudendal neuralgia is a lot. You think of like hardcore cyclists will get it because they're sitting on the bike seat and pushing on that nerve area. Because the other symptom I was having just within the last year was hemorrhoids, and I was like, I'm like, is it an age thing? Am I finally just getting hemorrhoids for because I've never had them in my life, and all of a sudden I got them and I couldn't get rid of them. Like every 3 months I would have them,
Right.
and so that ends up it's the pudendal neuralgia was causing that.
Okay.
But the reason I had the compression on the nerves was because of sclerotic tissue, aka endometriosis, was just covering those nerve bundles. So they had just slowly over time just compressed down, so there was not enough blood supply going to them. Yeah. So that ended up being part of my procedure as well. That was a bit of a last minute decision. That was a very scary decision because it takes the typical 3 to 6 month surgery recovery and puts it out to 18 months.
Oh, wow. Okay.
So I'm just halfway through now with that. But on a good note, I haven't had hemorrhoids since.
That is a very good note.
It is, which was fascinating. So he did a pelvic exam just before going into surgery to double check, to sort of corroborate the MRI results with the physical exam as well. Mm-hmm. So did a digital exam on the uterus and definitely felt around the uterosacral ligaments and felt the thickening, because that's the other thing that drives me crazy. That could have been diagnosed in every digital exam I had.
Yeah.
I could have been diagnosed with the fibroids just by palpating my uterus. It should not hurt. When a doctor puts their finger in you and touches your uterus, it shouldn't shoot you up the back wall.
Yeah. Yes.
That's not supposed to hurt. And again, same with they could tell just by feeling the uterosacral ligaments that they were fibrotic and thick, and they're not supposed to be. Mm-hmm. So again, it's an education thing.
Yeah.
And they know what they're doing there. I went into surgery. I actually asked for the video of it. I have the videos of my surgery, which is for me, I'm like a medical nerd, right? And so it was wonderful to have. It was about, I think I was in surgery for about 4 hours, actually pretty quick. Because it was, let me see, what did he find in the surgery itself? So there's many adhesions. Like it was, when I looked at the surgery, it was like going through like these like layers of spider webs to get through. It was really fascinating. So like fascial adhesions. And definitely the uterine fibroids. I definitely had deep endometriosis on the sacral. So it was basically everything in the MRI was confirmed in the surgery. He doesn't like staging. He doesn't like calling the stages. He doesn't agree with that model. So I definitely had I didn't have any endometriosis on my rectum specifically, but I had a lot of superficial endometriosis underneath on the peritoneal cavity there, which explains the bowel symptoms, right? Because if your rectum is expanding when you're about to have a bowel movement, it's pushing on that endometrial tissue, and so it's going to create inflammation and it's going to create all that kind of pain. So I definitely had, in the sacral uterosacral ligaments, there was a lot of fibrotic endometriosis there. And definitely just some general pelvic endometriosis. I asked him to clear my diaphragm. I said, please take a really good look at my diaphragm, because I have another condition that I really truly think is very much associated with endometriosis that hasn't truly been studied well, because we're women. But Yeah, so definitely it was validating for me.
Wow.
I, and because of the bladder, it was fairly extensively glued to my uterus
Yeah.
that I was put, I had a urinary catheter for a week post-op, because he really had to, I mean, he basically had to
Repair.
pull my bladder off, and, he didn't have to, he basically had to essentially shear off outer layers of the bladder wall, which is muscle, right?
Yeah.
Muscle and nerve tissue. So like my bladder, it was not fun for the first. I was worried that I wasn't gonna be able to pee without a urinary catheter again. But took me about 3 months to I feel like I'm mostly back to normal urinary sensations. That was a bit scary.
Yeah.
Yeah. So I was in Romania for 2 weeks post-op as well, and had,
Okay.
a post-op follow-up with him there. Had some interesting experiences with their healthcare system. Some challenged my using my voice, but still nowhere near. None of it was ever dismissive of what I was experiencing, though, and that was very new for me. Yeah, yeah. So I've had surgery. It's been
How are
8
you
months now.
feeling? Yeah.
Good.
How
It's
do you
been it's
feel
been eight
now?
months. Um, the nerve decompression is certainly
Yeah.
still a factor.
Mm-hmm.
I still have a lot of altered sensation in my genital region, um, and that's scary. But
Mm-hmm.
I'm a firm believer that my nerves will heal themselves. And I also did a bunch of research, and I know that those nerves heal at 1 to 2 millimeters per month. And so I've like actually figured out, like, this is how long it's going to
This
take
is the
possibly to heal.
timeline. Oh,
It's like how long it takes your fingernails to grow, right?
yes.
So,
Yes.
nerves, especially in that area, it's really hard to get blood flow to those nerves. So, being very patient with that. Um, but my very first cycle would have happened, not like my first mid cycle would have happened like while I was in Romania. I've now had, I still keep track of when so here's the rub. Actually, so surgery, I did have my uterus removed. I had my cervix removed, and I had my fallopian tubes removed. They were able to keep my ovaries because they were perfectly in healthy shape, and why
Yeah.
take those away and force myself into an early menopause, right?
Right.
But aside from having hormonal cycles still, which I very much am run by emotionally,
Mm-hmm.
and I still get migraines. Unfortunately, I get them so this is how I actually know when I'd be getting a period still, because I have a 3-day headache at the onset of my period usually, because my estrogen and progesterone have like
Yeah.
flatlined. But my first mid-cycle, nothing, no pain, no waking up in the middle of the night wanting to die. Like,
Oh, wonderful.
it really was. And I had said to myself, because I know the course of endo for a lot of people is not a one and done, right?
Mm-hmm.
But I also now know that the mid-cycle pain was less endo and way more of the uterus itself, the fibroids, and they did histology, and it actually wasn't. So here's the interesting thing. It wasn't actually adenomyosis. It was fibroids and what they call endometrial hyperplasia, which,
I've heard of
yeah,
that.
which is, it's often confused with adenomyosis, but it's actually, they're very different, but they create a lot of the same problems.
Okay.
So that was interesting to know, because again, my uterus was really heavy and boggy,
Yeah.
but it wasn't the muscles. It wasn't the muscle layer itself. It was just the outer layer was thickened.
Right.
But yeah, yeah, I've had like 8 cycles since, and they've been pain-free from the mid-cycle standpoint. I still feel like I know when I'm ovulating, but I think it's more normal.
Right. Right.
Like, I feel like an actual little twinge. I'm like, oh, I think I just
Right.
dropped an egg, right? Like, you know, and then, yeah, and then so the thing that I think is still happening for me, and again, it could be phantom, but I don't think it is I still get a little achy at when my period would be.
Mm-hmm.
So I do think that there's still something happening in there. I think it's
Mm-hmm.
mild, and I mean, by far mild in comparison,
Right.
but it's still cramping.
Yeah.
Because my body is still trying to absorb that egg, right? So
Yes.
it could just be very normal, and I'm just very aware of my body sensations.
Sure.
But yeah, overall, I'm very pleased. And I had said to myself, if I even have, it's worth it to me to have even 1 month without pain. So if this surgery only gave me a month, it was worth it. And it's given me 8. And and I'm just so grateful for each one that I have where I don't have to have that experience
Yeah.
for me.
I'm so
Yeah.
happy to hear
And
that.
for my
That's,
family. Oh my
yeah.
God. Like, this is
Yeah.
awful for them.
Yeah. I,
Yeah.
yeah, I'm so happy that you found them and that it sounds like it was such a wonderful experience and that you're
Yeah.
feeling better and sharing all of that with us on the show. I
Yeah.
mean, I think this is going to help so many people um because of your vulnerability and willingness to share. So thank you so much.
Yeah, I just think that, you know, we have a lot of advocacy, I think, to do, and if we have the capacity to do it, we really should engage in that process. And I definitely feeling much better now in the last little bit that I actually have the energy that I can start doing that more.
Yeah.
But yeah, we really need a pretty significant shift in our healthcare, especially in these areas. Like really just the patient knows thyself best. They may not know exactly what something is, but they definitely usually are spot on when they know something is just not right. You know, like
And
it's an intuitive sense of our bodies. We just know something's going on.
we have to change it like you mentioned earlier, medical school, like
Yeah.
it has to change from the ground up. I mean,
Yeah.
it it's a broken system. I hate to say it. I
It
haven't
really
talked
is.
to
Yeah.
someone. I've talked to almost someone from every country, and it's the listening and it's the early onset of symptoms. If we
Yeah.
can get intervention at the early onset of symptoms, I'm hoping you and I won't have to have conversations
Yeah.
like this in 10, 20 years because they're
Yeah.
able to mitigate it sooner. And
Yeah, I think the more awareness we bring to it, the more voices that are yelling at the top of the mountains. Because there's a number, I mean, we just lost Red Wine, which was really
I
unfortunate.
know.
But his legacy though is building, right? And
Yes.
oh, here's a quick thing. So post-op back in Canada. Ugh. So God bless them. I had a physician covering for my regular physician, and they are actually OBGYN trained. And when we were going through the post-operative report, she kept saying, so did they just laser it? I'm like, no, they excised it. So she's like, so they used a laser then? I was like, no, they actually chopped it out of me with a scalpel. And so I knew in that moment, I was like, even she, trained in obstetrics, does not know A, the gold standard for endometriosis treatment, and B, doesn't know the difference between laser removal and excision. Um, and then the other part of the rub for me on that one is I said, should we not update my referral now to let them know that I've had this surgery done and I really need a specialist to follow me now and for my ongoing care, especially if I run into any issues post-operatively now that I'm back in Canada. This is what I was told, almost verbatim. If we update them and they find out you no longer have a uterus, you will be bumped off the list.
Why?
Because
Why?
I, from a, I mean, I can speculate why. they triage people that might produce children over people that are certainly not going to be able to. So even though the referral was for endometriosis, in our country, endometriosis care is triaged in such a way that your suffering doesn't matter so much, but your infertility potentially does.
Yeah, I know. I feel
And
like
that was really hard to hear. That if I no longer have a uterus, I no longer matter, is what she
yes,
basically said to me.
yes. How
Yeah.
incredibly dismissive and hurtful, and
Yeah.
this is 2024. Like,
This is 2024,
how?
and the thing is, I think the harder part for me with that is herself as a physician knows that that's the state that they're in, and quietly sits back and goes, that's just the way it is.
Yeah,
That's just how it
it's
is. It's like, hello, maybe we should address that.
it's so I know. I feel like we could do a whole
Ugh.
separate show on like the medical system and all of
We
that.
should.
We
Maybe we
should.
should.
Honestly, I'm about to
Yeah.
read this book, which I am going to read it before I recommend it to everybody, but it's called All in Her Head,
Ah, yeah.
by Dr. Komen. It just
Yep.
came out. She's an oncologist, and
Okay.
and it goes through the history of why women's it's the truth of and lies of early medicine taught to
Yeah.
us about women's bodies and why
Yeah.
it matters today. So I'm
Yep.
really interested to dig into that book, because this is it's so deep. It's so,
Yeah.
even the female physicians are
Well, they're indoctrinated in the same.
right.
They're
Yeah.
indoctrinated, right?
Yeah.
They
Yes.
yeah.
My family
Yeah.
doctor,
Yeah.
I love
Most
her,
of my
but
dismissive physicians have been women,
same,
which is
same.
I mean, granted, there's definitely been a handful of male physicians, but
Uh,
the ones that hurt more are definitely the ones
yes.
from
Yes.
women. I was like, how can you? You know, I know you know,
It's
right? Like it's so hard.
it's very disappointing.
It
It is.
requires a lot of grace and compassion, but also I think the anger is good. You know, anger can be very motivating.
I agree, and a lot of times I used to be very angry at the doctors and very angry at the medical
Yeah,
system, but I've shifted how I feel about that into
yeah,
empathy and action,
yep,
because it's the doctors should know more, but they weren't educated. So it would be
yeah,
like, I work in marketing. It would be like a silo of marketing that I was never educated in. How am I supposed to know it? And
yeah.
it doesn't make it okay,
No.
but I also look at it more as an empathetic, compassionate, how do we change it from the ground up?
Yeah. And you
So
know, the Google, especially nowadays, is a masterful resource for patients because
it
the
is.
information that we have access to is exactly the same information that the medical professionals have access to.
Mhm.
And I think one of the biggest shifts in medicine will be when the physician can actually recognize that they're just a guide. They are really truly a guide, and the patient is the one that should be directing the journey. And if they could just a little ounce of humbleness, where if a patient says, "I'm pretty sure I have this," and not say, "Oh no, they don't have that." Like maybe say, "You know, why is it that you think you have that? You know, what information do you have? What are your?" They just don't. They don't do that. That
Well,
would
and
be nice if they did.
and then they're rushing, and it's because the insurance company, at least here in the U.S.,
Oh
they can
gosh,
only
no,
have
the
like,
insurance model exists in Canada as
yeah,
well, just not exactly in the same way, but it's driven by it for
15-minute
sure.
appointment. You have to see so many
Yeah.
patients, and it's
You
like
can
you're.
only bring up one issue at a time in one appointment. You're like, seriously?
So
Yeah.
it's so
Yeah.
systemic, like it is
Yeah.
so deep,
Yeah.
but there's hope.
We could definitely do a whole series
Yeah.
or a whole talk just on that.
Yeah, I think
It should
we
probably be a
will
good idea.
yeah, we'll revisit it.
Yeah.
Let's keep this with your story, and I think let's
Yeah.
table, and I think we could come
Yeah.
back and let me read this book too, because I feel like I want
Yeah.
to try and have her on the show, but
That would be amazing.
oh my gosh, it would be so
Yeah.
amazing. So yeah, I think we can come back to that, and I think there is
Yeah.
a lot to discuss there. Um something that you said reminded me, and I might not quote this exactly correct, but it was like your doctor is the coach and you're the athlete. So like it's
Yeah.
some sort of like exactly what you were just saying. Like, you know, everything.
Yeah.
That
The
person is
doctor's
just,
job is really to help you translate what
yes,
your felt experiences of your body. Like
yes,
they're there to basically be a guide and a translator for you,
yes,
and then to help you access the treatments and modalities that would be most helpful. But
for you.
again, since our medical healthcare system chopped us all up into little pieces,
Yeah,
and we're all in these little systems, there's no real holistic look at the way the human body and mind work together, right?
yeah,
And so
yeah,
if your cardiologist is not talking to your respirologist, who's not talking to your gastroenterologist, who's not talking to, so on
yeah,
and so forth,
exactly.
how are they ever going to connect the dots?
And that's
Yeah.
exactly, I think the initial thought was like the family doctor was supposed to be that person, but it doesn't work that way. They're just referring you to all these other doctors. But
Yeah.
anyway,
Yeah. Yep. We
is there
could,
anything
obvious, we could
else?
go, we could
I
keep
know, we could
going.
go forever. Is there anything else you want to say about endo or your story or advice to people who are listening, or anything that we didn't cover?
Not really, no. I had a little funny experience, yesterday. I ordered underwear. Okay. But, I ordered underwear from this I'm actually going to be doing a plug that I'm clearly not getting paid for. This company called Hoo Ha. I don't know if you've heard of them.
I haven't.
Okay.
Cute name.
So it's like hu-ha.com, Hoo Ha underwear. But they donate 1% of every order to a charity of your choice. And I had ordered it, got the wrong size, sent a bunch back. I just got the email yesterday. It's like, here's your gift card, you can reorder. And so I went on, reordered, and then because my order is now in March, they're supporting endometriosis as one of their charities. And so it was funny to me because, and I wrote it down because it was so interesting. I chose to donate my 1% of my purchase to the endometriosis awareness. So they donate to the Endo Coalition, which creates awareness and reliable and accurate education and increasing grant funding. And they actually support medical costs for people that can't afford it. But the beauty of this was why I'm telling you this story is because one of the biggest myths, as you know, is endometriosis happens in the uterus, right? Right. That's like
Yes.
the long-standing understanding is that it's
Old.
in, oh my gosh, right? But so the email itself is like Endo Awareness Month, and the education they give, and I should just read it to you almost verbatim just because it was so good. They said, it's a chronic disease where tissue similar to the lining of the uterus grows outside the uterus. And I was just like, yeah, right? Like
Amazing.
it was amazing. So that's how I know we're all going in the right direction. An underwear company knows what endometriosis is and is
Awesome.
supporting it, and they have a wide reach, right?
Yeah.
So
That's,
it's just a matter of time.
yes. And
Because
I've
that's
seen,
how change happens. It's the people first, right? We have to tell the medical community, no, enough is enough. Stop messing around, right?
well, and the reason why I started this podcast was because
Yeah.
endo's so different. I'm a broken record when I say it, but it really is so different for everybody. Something that you said today on the show, I had never heard before. So other people are going to hear it for the first time. It's,
Yeah.
we as the patients telling our stories and advocating, like you said, is going to help
Yeah.
make the change. And Endoco they partner with Little Words too, and they do really cute bracelets that give back
Oh,
as
cool.
well. And I've gotten one of those before too. So I'll link them in the show notes.
Okay.
And then Billie Jo, if you send me the link to that study that we were talking about, I'll
Yeah,
link
for
that in
sure.
the show notes too for
Yep.
everybody. But I really thank you for this, your time and this
Yeah.
incredible conversation, and for you being here and sharing all of this with us, because it's going to help so many people.
Yeah, thank you for having a platform for people like me to share my story. So if it wasn't for you, I wouldn't be here sharing my story. So
Oh,
really much more thanks to you.
oh, thank you so much. And thank you,
Thank you.
everyone, so much for listening and for being here. A little new intro and outro on the shows. I'm sure you may have noticed, but thanks for being here. Don't forget to subscribe, like the show, however you're listening or watching it. And if you feel inclined and you think it was great, if you could give us a 5-star review on Apple or Spotify, that just helps get more reach, get more guests. And I really appreciate you being here. Thank you so much.